This week, state officials are bracing for some tough times ahead and scrambling for supplies to battle the pandemic. Johns Hopkins experts say there are several things that need to happen to control the outbreak before scaling back social distancing measures. WMAR 2 News' Abby Isaacs explains tonight.
Experts couldn't give a timeline, but instead listed 4 things they say need to happen in order to decrease the threat enough to safely regain some normalcy. This was addressed during the first in a series of press briefings from experts with Johns Hopkins Bloomberg School of Public Health. Dr. Caitlin Rivers spoke about her research on the outbreak in 4 phases, saying we're in phase 1, and there are some things that need to happen to move to phase 2, which is a more case-based intervention with less social distancing protocols. First, she says we need to continue social distancing and see a declining number of positive cases every day for a 2-week period. The others have to do with building up infrastructure, having enough healthcare capacity to treat everyone who is sick with sufficient equipment, having enough testing for everyone with symptoms, and scaling up public health capacity to take on contact tracing. She says the timeline depends on how fast states move.
In order to scale up those programs, it's a huge undertaking. There's a lot of infrastructure to be put in place, and we can't just do that in one place. It really needs to be filled up in every community, and so it's going to depend on how quickly we're able to get that rolling.
She estimated we're still months out from complete normalcy with therapeutic interventions and a vaccination. In looking at the data from New York City, she's confident that social distancing is working and will slow the spread of the virus. She said in the next week or so, we should start to see the impacts on Maryland data. For WMAR 2 News, I'm Abby Isaacs.